Hello, my name is Alyssa Hellenbrand, and today I will be talking about the topic of equine veterinary medicine. Specifically today, we will be talking about core vaccines, where to give them, what injection it is considered, as well as how to deworm and what the proper deworming schedule is for your friendly equine. I hope you will enjoy this informative video on equine veterinary medicine. Thank you for watching. On our first topic, we will be discussing the 4 basic core vaccinations for equines. The AVMA defines core vaccines as those that protect from diseases that are endemic to a region, those with potential public health significance, required by law, virulent, highly infectious, and or those posing a risk of severe disease. So the 4 vaccines that are actually core for equines include the Eastern Western Equine Encephalomyelitis, the rabies, tetanus, and the West Nile virus vaccines. Just a little quick fact on rabies vaccinating in horses. Before we actually talk about the injection sites for these vaccines, we're going to discuss a little bit of safety precautions. When giving an injection to a horse, you should always have a handler, and this handler should always be standing on the same side as the person giving the injection. It is not recommended to tie your horse rather than having a handler. However, in this video you will notice that I do have my horse tied. The second thing to be sure of when dealing with injections on a horse is proper handling of the medication. Since some drugs can be absorbed through the human skin or can produce adverse reactions if accidentally injected, we have to make sure that we handle the medications according to the label directions and be extremely careful with the loaded syringes. Make sure that when you are capping, you do not accidentally stick yourself. This is the most common way for accidental punctures to occur. The next step is to make sure that before you give any injection, you check and double check the dosage, the frequency, and the route that the vaccine should be given. My 4th safety tip is to make sure that drug storage is always done properly. Make sure that you store your drugs according to how the label says they should be stored. If they need to be refrigerated, do not let them get to room temperature. And finally, my last advice on safety. Make sure that you always use a sterile needle and syringe for every injection. Never reuse either a needle or a syringe because it can be contaminated and introduce dangerous infections into your horse. We recommend using individually packaged needles and syringes. Open immediately before using and dispose of immediately after use. Now I will show you the 4 different IM injection sites for equine vaccines. The first site is at the base of the neck. The site is both easy to find and is relatively safe for the injector. The second IM injection site is the pectoral region. It should be noted that this muscle group is prone to becoming sore easily and should only be used when the horse is receiving prolonged treatment. This site does put the handler at some risk of being kicked or struck, so use caution. The third IM injection site is the gluteal muscles. It is a large, frequently used muscle mass that allows the injector a relatively safe position to inject from. It should be noted that a major disadvantage of this area is that in case of an injection site abscess, there is very poor drainage and therefore more difficult healing. This is a site that should only be used in the case of prolonged treatment. Lastly, the 4th IM injection site is the semitendinosus or hamstring area. This area makes for a good injection site, but the major drawback to this injection site is that it puts the injector in a dangerous position within kicking range of the horse. We recommend this site only for experienced horse handlers. Now we will talk about deworming a horse. For an adult horse, normally you get a fecal egg count performed prior to the deworming in the spring. Ideally, you get a fecal done in spring and fall. Around spring, which would be around March, you treat them with ivermectin and moxidectin, and then in fall with ivermectin with proquenazole and moxidectin with proquenazole. Here is a short video of me deworming my horse for the first time. In an ideal world, I would have also had a handler. In regards to deworming protocol guidelines, some of the important points and recommendations are non-chemical parasite management, which includes rotating pastures, removing manure frequently, and avoiding overstocking the pastures. When you're starting deworming, you should deworm foals every 2 months starting at 2 months of age for the first year of their life, or use protocol for daily deworming. Just as humans are, every horse is a little bit different, so they will require different deworming programs, even if living in their same or similar environments. So just keep a record of the fecal exams and what your horse normally develops. At least once a year, you should measure the success of parasite control by doing the fecal analysis through your veterinarian. By using a dewormer with proquanazole in it, you can eliminate tapeworms from the horses once a year. One more little side note is don't use the same pasture or paddocks year after year for mares and foals. By using the same pasture or paddocks every year allows a buildup of high level of eggs of parasites, which can be hardy and can live for years in the environment. This can even happen in stalls. The best way to determine the deworming schedule for your horse is to involve your veterinarian and to perform fecal egg counts every year. An individualized deworming program can save money and allow the use of less dewormer, as well as make for a happier horse and owner. I hope you enjoyed this video about vaccinations, vaccination sites, as well as deworming and deworming protocols. I hope you found this video informative. Thank you for watching.